Hi, and welcome to the fifth installment of Understanding and Treating Anxiety from an Integrative Perspective. I'll be building on Simon, Ren, Dr. Eager, and Dr. Oscar's talks and zoning in on the vagus nerve and the key therapeutics around this particular nerve. My name's Luke. I'm one of the senior naturopaths here at the Health Lodge. My formal training is in clinical naturopathy, but I've also gone into further training in transauricular vagus nerve stimulation, alchemical herbalism, DNA analysis and nutrigenomics, and energetic medicine in various fields. So a little bit about the vagus nerve. We're going to be talking about the anatomy, the physiology, the biochemistry, also some of the psychology components around the nerve, the energetics, which I think you guys will find really interesting, some pathology considerations and clinical assessment, and then some of the research around the vagus nerve and anxiety in particular, because that's what this talk's all about, and the therapeutics and some of the take-homes that you can actually do at home as well. So just a little bit about the anatomy. The vagus nerve is one of the cranial nerves. It's actually cranial nerve 10. It's the longest of all the cranial nerves. So what that means is the nerve actually comes off the brainstem and travels through the body. It's estimated to be around 11 meters long, depending on obviously the person. And it contains both sensory and motor fibers, which means it receives signals from the environment, from the actual organs, and also sends signals out to those organs as well. There's two particular sites where the vagus nerve comes off the brainstem called the superior and inferior ganglion, and we'll talk a little bit more about those in just a moment. So when we look at the efferents, so the information carrying information back to the brain, we see the superior ganglion, which is the, I guess superior means above, actually correlates to the ear. So it's sensing information through that sensory organ back to the superior ganglion, which is like a little control mechanism for the nerve. And that's one of the sites we can actually access the vagus nerve for our therapeutics, which we'll talk a little bit later when we get to the therapeutics section. We also see the inferior ganglion, which is the control center, which is just below that, correlates to a lot of the visceral organs, so the sensation coming from the heart, the lungs, the digestive process, right down to the perineum in some people. And you can see a lot of the organs that are actually associated with this, so a lot of the muscles and through the neck and the esophagus, down to the digestive process, the gallbladder, liver, stomach, heart, lungs, and pericardium. And just a side note on this, there is a little intersection where cranial nerve 11 joins up with the vagus nerve right where this inferior ganglion meets. And another access point in our therapeutics is through the trapezius, where we can actually reflex back to cranial nerve 11 and support vagal tone that way as well. So the efferents, which are a little bit different, they're carrying information from the brain to the tissue sites. That includes the muscles right from the esophagus right down through the whole digestive process, the cardiac and the pulmonary plexus, so the lungs. And just a side note here, there are two main divisions of the vagus nerve, the ventral vagal and the dorsal vagal. They both innervate the heart and lungs, but the dorsal vagal primarily goes to the lower organs. The ventral vagal does to some degree, but it's mainly those upper heart, lung, and throat areas that the ventral vagal innervates. And we'll talk a little bit more about that when we get into the psychology side of things, because that's really important. So in terms of the physiology of the nerves, 80% of the nerve fibers are afferent, which means that it's really a sensing nerve. This vagus nerve goes out into the environment, whether it's the ear or whether it's the throat or the lungs or the heart or the digestive process, senses what's going on and sends that information back up to the brain so the brain can make decisions on what to do. And 20% of the nerve fibers are actually the ones that are sending the signal back. So it's really about sensing our environment around us, and that's why there's so many potential therapeutics to actually help this nerve. In terms of the biochemistry, we see activation of the vagus nerve actually leads to the release of acetylcholine, which is the major neurotransmitter of the parasympathetic nervous system. So most people know a little bit about the parasympathetic and the sympathetic nervous system. So the parasympathetic nervous system is the part of the nervous system which calms us down, relaxes us, makes us feel grounded, safe and secure. And that's obviously what we all are aiming to feel. And the acetylcholine, which is released by the way of the vagus nerve, has significantly shown to reduce some of the pro-inflammatory cytokines like TNF-alpha, interleukin-1, 6, and 18. And we would have seen from Dr. Igor's presentation earlier that anxiety really is a pro-inflammatory state of the brain. So by stimulating and getting the vagus nerve working well, we can actually reduce some of that neuroinflammation, which will have a direct impact on neurological conditions as well. The interesting part, I think, for some clinicians out there that are watching this is the ventral vagal, which is, I guess, the more recent part of the nerve, is myelinated, which is basically like a little insulation on the nerve. And that will send signals up to 40 times faster than a non-myelinated nerve. So this will come into play a little bit later when we talk about the nutrition and the nutrigenomic aspect of supporting the vagus nerve and how we can actually do that through supplements, foods, and DNA testing. You would have seen from Simon's talk, who's the head psychologist here at the Health Lodge, that obviously anxiety and polyvagal theory, there's different aspects around supporting people using this framework. So I just wanted to talk a little bit about the psychology of the vagus nerve. So with the ventral vagal state, that is really the state where we're socially engaged. We feel calm, we feel grounded, we feel settled, we feel connected, we feel part of community, and that's generally where we all like to be most of the time. But then something will come along and set us off into a fight or flight situation. So that might be a bill coming in, that might be the news, that might be the partner or the kids or the job or whatever that might be. And there's two responses that we generally take in this situation. We either fight and have a response, or we flee the situation. When that gets too much, or it's a situation, let's say like a car accident or something, and we go into a big shock state, we can actually go into shutdown, which is considered the dorsal vagal state. And that's where we see things like depression, numbness, helplessness, shame, shutdown, those sorts of feelings. Now, I will mention there are some other states outside of ventral vagal sympathetic shutdown and sympathetic fight or flight and dorsal vagal shutdown, which include the freeze state. Now, some people say the sympathetic state is fight, flight, freeze, but I think that the freeze state is somewhere between the sympathetic and the dorsal state. So it still is a very much activated state of being, but it is like a shutdown state in its own way because we're stuck. So it is that sort of balance between fight or flight and dorsal vagal, and in my viewpoint. We also see intimacy as another state, which is you're very much in that social engagement state, but you're also in that calm dorsal shutdown state as well. And then we see the play state, which is more of a balance between the fight or flight and the ventral vagal social engagement state. And you could use the analogy of sports for that. So if you're playing a sport, it's competitive, but there's certain rules and you feel safe within those rules. So a little bit more on the polyvagal theory. The oldest of these nerves is actually the dorsal vagal nerve, which is part of the parasympathetic nervous system and enables us to shut down when a situation feels too dangerous and we've become too overwhelmed. The second state is the fight or flight state, which we talked about, and the most evolved state is the parasympathetic ventral vagus state, which helps us with social communication and social engagement. I'm going to talk a little bit about the energetics, and this is something that's quite close to me, being a herbalist and nutritionist. We're often looking at the biochemical properties of herbs, but also considering the energetic properties of the herbs. So I really wanted to talk about some of the frameworks, because clinicians watching this may be from other modalities like Ayurvedic medicine or Chinese medicine or alchemical medicine. So being able to give you guys a little bit of a model to work with and how this correlates to the different vagal nerve states. So I guess I correlate the dorsal vagal response, that shutdown response or life threat response to these two elements being earth and water, we can see that earth is a very fixed state of being. And in Ayurvedic medicine, you might associate this with the Kapha dosha, the water and earth together forming a fixed solid structure. In Chinese medicine, you might associate this with the Jing energy of the three treasures. So if we see a completely shut down or wiped Jing energy, you might see someone in that dorsal vagal state. From an alchemical point of view, we see that with the salt being the base matter, and the mode of astrology, for those astrologists out there, we see that as the fixed state, so the stuck state. The physiology tends to be slow, and keywords associated to things like collapse, immobility, numbness, and depression. So we're looking at with this dorsal vagal state is shut down. You may have been in that fight or flight sympathetic state for a long time, and then you finally crash, and it takes a lot of energy to come out of that. So we see that really shut down state with the energetics here. The other state being the sympathetic state. So we see the fire element come into play here, and and also the water element as well. So when we think of fight or flight, for those fighters out there, we might call them fiery personalities, or we might say things like they're letting off steam. We see that water element come into play. In Ayurvedic medicine, we'd associate this with the Pitta dosha. In Chinese medicine, the Qi energy or the flame coming off the candle. So building from Jing into Qi. You see in the alchemical principles sulfur, which is expansive, so coming up and out, cardinal in astrology, and the physiology of this is fast. So we're seeing a quick reaction here, whether that is to fight or to flee. It's a really quick response we're seeing in this fight or flight response. And some of the key words, if you're in that fight stage, you might see rage, anger, irritation, frustration. And if you're in the flight stage, you might see panic, fear, anxiety, and worry. And then the ventral vagal state. So this is really the state that we're all trying to get to and would like to be in most of the time. And this is a social engagement safety state. So we see this correlate with the air and ether elements. So interestingly, the air element correlates to our lung capacity and utilization of our words, and the ether element is really the embodiment of everything around us. So that's that real connection with community and something more than the self. So in Chinese medicine, we would see that as the Shen, which is the spirit or the mind, the consciousness, the light being admitted from the candle. In Ayurvedic medicine is the Vata dosha. In alchemical principles, it is Mercury, which is transcending both the liquid and the solid states. Mode of astrology is mutable, which is really about flexibility. It moves, it can change, and that's what we want to be, is adaptable when we're connecting with people. We need to be able to adapt to our environment in a safe way. And then the keywords are calm, connected, settled, curious, open, and mindful. One of the interesting papers I came across was the correlation between the Vata dosha and the vagus nerve. So there's people out there looking at these main components of how the Vata dosha is described in a lot of the texts versus the way that the actual vagus nerve functions. And I think there was two key points in this paper which made that very similar distinction. One was the Vata dosha and the vagus nerve maintain the neural, respiratory, and digestive processes. So that's the physiological side of it. And oftentimes with the Vata dosha, it's about regulating mental health and behavior. And that's where we see the polyvagal theory and the psychological component come into this. So I think that'll be an interesting area to explore for all of those Ayurvedic practitioners out there, and maybe can give you a bit of a framework to actually look at this polyvagal structure and apply it to your herb and nutrition choices. So when it comes to the pathology, these are some of the disease states that have actually been shown to correlate with vagal dysfunction and also show improvement when we do things like vagal nerve stimulation, whether that's through direct stimulation or practice to actually upregulate the vagus tone. And you can see there's quite a wide variety of different dis-ease states that are associated with vagal dysfunction. So if any of you out there are actually suffering with any of these particular diseases or conditions, looking into the vagus tone and how we can upregulate that would be definitely a consideration. And obviously this talk we're honing in on anxiety primarily, so we'll be getting into some of the therapeutics around that a little later in the talk. So when it comes to clinical assessment, there's certain things that we can actually do to assess the vagus nerve in clinic. So a lot of my patients, this is just standard practice for most of the people that come to see me. One is assessing the uvula, which is the little dangly bit at the back of your throat. And you can actually do this at home just by sticking your tongue out and saying ah. And what you're looking for is that little dangly uvula at the back lifts straight up when you're saying ah and comes back down when you finish. If you see the uvula swinging to the left or the right, that's usually indicative that one side of the vagus nerve isn't functioning well. And if you don't see your palate lift come up at all, that's usually a sign that the vagus nerve isn't online at all in that moment. So, and probably would warrant further investigation or seeking out a therapist. Another way we can assess the vagus nerve is cervical extension. So just seeing how far we can actually put our head back. A lot of the time, we see people that have had a neck injury correlate with vagal dysfunction because the nerve actually comes through cervical spine 1. And if you impinge the nerve, you often might see vagal symptoms, whether it's digestive, tachycardia, anxiety, those sorts of things as well. We talked a little bit about cranial nerve 11 earlier in the talk, which meets up with the vagus nerve. And cranial nerve 11 actually controls your trapezius, which is a muscle that comes off the back of your neck and down through your shoulders, and your sternocleidomastoid muscle, which comes off your jaw and down the side of your neck. And they're both really important muscles when we're looking to move our body. So if we see danger in the wild, if we see a tiger running at us, we need to turn our head and our shoulders before we can start running away with our arms. So having a brain nerve that works that little bit faster than a skeletal nerve send that signal can sometimes be the difference between life or death. So when we might not have a tiger running after us every day, but like I said earlier, we have the bills, the kids, the family members, the television, all of these things that send these stresses. They tend to affect that particular area of our body. And you could probably all attest that when you get stressed, you might feel it in your neck and shoulders. So when it comes to assessing the vagal tone, sometimes checking the neck and shoulders and especially the trapezius muscles, if they are very tight and locked up, that's usually a sign somebody is in the sympathetic state and they're being activated. So another way we can clinically assess the vagus nerve and the vagal function is through heart rate variability, which is measuring the space between the heartbeats. And there's a lot of evidence out there, HeartMath Institute has a lot of research into this, that the higher the heart rate variability, the less disease we seem to have, and we also see that directly correlate with vagus nerve function. So often in clinic, I'll do a heart rate variability measurement before and after a vagus nerve treatment. And a lot of the times we'll actually see that heart rate variability increase even with one session, which is fantastic. And the other ways we can look for clinical assessment of vagus nerve dysfunction are looking for some of the primary symptoms of vagus nerve dysfunction, which is tachycardia or racing heart, vocalization changes, so whether that's hoarse voice or croaky voice, breaking your voice, difficulty swallowing, tinnitus is one of the primary symptoms of vagus dysfunction, and a lack of gag reflex. For clinicians out there, you can obviously look for other signs of dorsal vagal like cold hands and feet, pale skin, slow speech, low blood pressure, and if someone's in that activated sympathetic state, you'll see higher blood pressure, generally red skin, rapid pulse, agitation, and those sorts of things. We also need to, I think, as clinicians, make sure we're taking a thorough case intake. So what I'll often ask is about the birth history. So we see with birth trauma, forceps use, those sorts of things. Sometimes they can impinge certain nerves. We also see that cesarean section births have lower beneficial bacteria levels, which can actually potentiate dysbiosis and inflammation in the gut. And we also see that those that have been breastfed tend to have better myelination as well. So obviously there's no right or wrong with this. Every situation is completely individual, but when we are looking at dysfunction, we want to make sure we're assessing some of these factors. Like I mentioned earlier, injury history is really important when it comes to vagus nerve, especially at that C1 where the vagus nerve actually innervates. So that could be through contact sports, vehicle accidents like whiplash, or even falls. There is some documentation around surgery, certain surgeries that have actually affected vagus nerve function, and certain medications, some of the antibiotics, have also shown to affect the peripheral nervous system as well. So these are the things that we kind of ask in a consultation based on your history to get a bit of a guide and a gauge on where your vagus nerve function actually is. So moving on to some of the other things that we might ask about is viral infections. So interestingly, there was a paper that came out in April this year which linked long COVID symptoms possibly with the vagus nerve, and they actually found physiological changes in the nerve for those that have been diagnosed long COVID. So obviously that's been the most recent global pandemic which has affected all of us. And I think that's something that we can, which will probably come out with more information as we learn more about this particular disease. But it is something of note, and there have been others that have speculated that viruses can be behind some of these other chronic states like chronic fatigue, which are affecting the vagus nerve as well. So knowing somebody's history that correlates to vagal dysfunction can sometimes give us a clue in that particular area also. Another area that we might like to ask about is things like work history. Where did you grow up when you were a child? What sort of house did you grow up in? There has been some studies done on toxic metal exposure and the effects on the vagus nerve. There was a study done on copper factory workers where they associated lead exposure with vagus nerve depression, and also some rat model studies showing mercury exposure affecting the heart rate variability and vagal tone as well. So we see that quite a lot in our clinic. Obviously, the type of people that are coming to our clinic usually have more than one issue going on, and this is why thorough intake is really important when you're looking at vagal dysfunction. So another factor is nutrition. So obviously, considering the ventral vagus nerve is myelinated, we need to consider the type of nutrients that actually build the myelination sheath. And we go a little bit further sometimes in this clinic. My training in nutrigenomics, start to look at what type of genes might be associated with the body's ability to utilize some of these nutrients. So we see some of the key nutrients and genes, the vitamin B12, folate, choline, the omegas, and some of the neurochemistry can sometimes give us clues and insight to somebody's condition, whether it's vagal dysfunction or, like we're talking about in this talk, anxiety. There's also, obviously, like I said, we're talking primarily about anxiety in this talk, so I wanted to make sure I included some therapeutics and studies around anxiety, depression, PTSD, and those states of disease. So we see anxiety disorders are associated with reduced heart rate variability. So we talked about that earlier, that heart rate variability is one of the reliable markers to measure the function of the vagus nerve. So this study was actually a meta-analysis of a lot of different studies which concluded that anxiety disorder is actually associated with lower heart rate variability. So we know that by supporting vagus tone or the vagal nerve, you'll actually likely see improvements in some of these conditions. We also saw that a meta-analysis done on vagus nerve stimulation actually ameliorated the major depressive disorder by about 33%. So that was a huge indication that the vagus nerve can be behind some of these neuro disorders that we see in a lot of patients that come to us. There was a pilot study done on PTSD which showed vagus nerve stimulation reduced some of the pro-inflammatory cytokines that have been associated with this condition, and we often test for some of these interleukins. So when we see somebody come on with an immune dysfunction or a pro-inflammatory state, this is one of the tests that we might order where we can measure interleukin 6, interleukin 8, and some of these pro-inflammatory interleukins, and then provide the therapeutics, the vagal therapeutics, and remeasure, and we often see very good results. And this comes to the therapeutics. So essentially, when in clinic we're doing vagal stimulation, there's particular sites in the ear that we can actually access the vagus nerve. So we talked about earlier in the anatomy and physiology the superior ganglion, which is the little control center where the nerves go out towards the ear. And it's at these ear points we can actually send a pulse or a stimulation back to the vagus nerve. And there are definitely other ways you can stimulate the nerve, and we'll get into some of those, but I use the example of some of the other at-home treatments are like, if you're exercising, it's like going for a walk around the block. It's nice exercise, you'll get the heart rate up a little bit, but it might not get you, completely as fit as you'd like to be. Whereas the vagus nerve stimulation is like going to see your personal trainer. It really puts you through your paces, and we can really pull people out of that sympathetic fight or flight state, or even that dorsal crash state, into ventral vagal state where they feel calm, relaxed, grounded, clear, and present. But some of the at-home things you can do to actually help stimulate the vagus nerve are things like gargling, singing, and humming are all known to stimulate vagal tone. So they're often some of the exercises I'll give to my patients to do at home, and I always get really good feedback regarding that. Interestingly, there's a paper on chanting Om. And this was done against chanting other sounds like the S's and other vowels, but chanting Om actually it concluded that it correlated to increasing heart rate variability, and they associated that with likely by affecting the vagus tone. So that's another at-home exercise you can also do. So there's a couple of probiotics that I think are worth mentioning that both have association with both anxiety and the vagus nerve. So we see the Bifidobacterium longum and the effect that that actually has on the gut-brain axis, and also Lactobacillus rhamnosus, which also helped with GABA receptor expression through the basically vagally mediated. So again, both of those particular probiotic species correlating to upregulating the vagus nerve. And I guess the vagus nerve, because it's such a long nerve, I kind of think of it as the superhighway between the gut and the brain. So we've all heard the gut-brain connection. Well, this nerve has a huge, huge part of that. It's like one of those super freeways where the gut and the brain are communicating together. Another mention I'd like to say is screen time. Obviously, with the adjunct of technology, we're all on our phones and computers more than we all should be. But also, along with the known risk factors of technology use, like radiation exposure, one of the things you'll see in this image here is that poor posture. It's something that I pull myself up on all the time, looking at the phone and putting the head down. And we're actually seeing more cervical kyphosis coming through. And that's important when we're talking about the vagus nerve, because the nerve actually innervates at the top of the cervical spine. So if we're constantly looking down and stretching out that neck and straightening out those cervical spine, we can see knock-on effects into that particular nerve. The other thing is, depending on what we're watching on our screens, things like social media, where you're flicking through your feed, you're constantly getting that dopamine hit. And we know dopamine does convert down into adrenaline and noradrenaline and activates the sympathetic nervous system, or that fight or flight response. So it's just something I'm always mindful with my patients to talk about their screen time. Obviously, I'm presenting this through a screen, and I work in front of a screen, but I guess it's finding that balance in this world that we live in now, from making sure that we're not overdoing it on the devices. And these are really the 7 key therapeutics. So obviously, being a clinician now for quite a number of years, I've seen people that follow these and those that don't, those that take 20 different supplements and 5 different therapists, and those that don't have that luxury. And I always find that when people have these key lifestyle markers in their life, they always do better, no matter how many supplements or therapists or other factors. And there's a wide variety of reasons for that. So those 7 are exercise, time in nature, sunlight, meditation, socialization, music, and a lower screen time. And if we had a bit more time, we'd go through each of those one by one and go through all the different facets of that. But we all know that most of these things are good for us. It's just prioritizing the time to make sure that they're a part of our day-to-day lifestyle. And for those herbalists out there, I want to talk a little bit about therapeutics and herbal therapeutics and how they might correlate to each of the states of the vagus nerve. So when we're talking about that dorsal vagal response, that shutdown response, or that deep freeze response, we're seeing that rosemary might be a great herb to think about when you have a person come into the clinic presenting with those symptoms. It's a sun-ruled herb, it's aromatic, so it's an up and out energy. It's pungent, so it's warming, it stimulates. It actually impacts the heart and the circulatory system and warms up the digestive fire. So oftentimes when I think of people that are in that dorsal vagal state and see them come into the clinic, they've really shut down, they're really lethargic. They've gone through their fight or flight response and finally crashed, and we've got to get them up and going again. So we want to get that fire element back into them and help lift them out of that dorsal vagal state. So I think rosemary is a beautiful herb. It's very accessible. It's a very safe herb. You can grow it at home. For those of you that are looking at-home gardeners, that's a nice herb to have around. For those that are in the fight or flight response, they come into the clinic and they're really wound up and they're really fiery. I always think of nettle. It's probably one of my favorite herbs. It's a Mars-ruled herb. It's a warrior aspect. It's very cooling. It's anti-inflammatory, and it's a great remedy for anger and frustration. In Chinese medicine, they talk about that liver yang uprising, that heat and energy coming up into the head and causing neurological issues and anger. And the nettle actually helps cool that and remedy that. So that's a beautiful herb, and it's a very accessible herb as well that most people can get their hands on. And for those that are more of that flighty state, so they're not fighters, they tend to flee and get that anxiousness wound up, and obviously that's a big part of what we're talking about today. Motherwort, I've seen work time and time again, especially for those that have that tachycardia aspect to their anxiety or that racing heart. Motherwort actually translates its Latin name to lion heart. So I feel like it's nearly like bringing that bravery to embrace the situation. It's a nervine, so it helps support the nervous system. It's a calming. It's bitter, so it's very grounding, and it does work between the digestive system, the nervous system, and the heart. So it's very good for those that feel their anxiety in that heart space. And I wanted to give a special mention. We've talked about the dorsal vagal herbs and the fight or flight herbs, and I associate calamus with that ventral vagal state. So it's a mercury ruled herb. The air and ether element are ruled by that. It's associated with the mind and communication and spirit. When we talk about spirit and community and connection, that's really what we're talking about with the ventral vagal state. In Sanskrit, vacha, actually the power of the word and power to speak. So calamus is one of those herbs that can actually help us with our speech, and that's a huge part of connection with people, is to be able to talk and express yourself. It opens the crown chakra to receive the vital force which travels and cleanses the body. The power to speak really correlates to having the willpower, so the power from the solar plexus and the speaking through the throat needs to travel through the heart. So we see the gut, the heart, and the throat all correlate to this particular herb. And we talked about that. That's really the where the vagus nerve travels. Traditional use, Native Americans would actually chew this herb to help with their throat and their singing. It's an aromatic herb, so it's got that up and out energy. It's also grounding. It's got that bitter aspect, and it's called an alterative, which means it helps us adapt to different situations. So there's just a little bit on some of the herbal therapeutics that you might like to consider for those herbalists out there, and for those at home that can get access to some of these herbs. So that's me, and that is the vagus nerve. So if any of you out there would like more information, you can obviously contact the Health Lodge. I do see patients remotely as well as in clinic, and there's a lot we can do to help support both nervous system disorders and some of the other disorders that you would have seen associated with the vagus nerve. And I wish you all a fantastic day.